We want to make sure that our population remains safe and healthy.
Winnipeg Regional Health Authority has seen a decline in immunization rates for meningococcal and MMRV, measles, mumps, rubella, and varicella in children born from 2019 to 2021. The meningococcal vaccine is recommended for infants at 12 months of age, but Manitoba Public Health has recorded a 6.2% drop in the vaccine uptake for 2021. Dr. Bumi Fatoye says low vaccination rates for meningococcal and MMRV can put the community's health at risk.
What it does is that it increases the potential for spread of that disease when it enters into the community. And these diseases can be severe and also very debilitating on those who have been affected.
As an example, she adds that meningococcal disease, although rare, can leave severe and lasting impacts on affected persons.
Data is showing us that about 1 out of every 10 may die from that infection. And likewise, even when people survive, about a third of them will be left with long-standing complications such as hearing loss, brain damage, or even other long-standing disabilities that could be prevented.
She says that high vaccination rates are important to not just protect ourselves, but vulnerable people in the community.
We have those who are, for some reason, due to underlying medical reasons, are not able to get the vaccine. What happens is that we're putting those groups at risk of being infected and getting the disease.
Dr. Fatoye says that many factors could be responsible for the decline in immunization rates for these diseases, but the interruptions in healthcare caused by the COVID-19 pandemic is the likely reason. She says that the decrease in rates is not alarming, but they are taking preventive measures to protect public health, launching an initiative with a number of vaccine clinics across Winnipeg for the month of April, with the hopes of catching up as many children as possible.
The decline we observed is a slight decline. We're not in a panic state. We want our children to be up to date. We don't want to get to the panic state. That's why we are encouraging families and to get out there to make sure that children are up to date.
In Winnipeg, Temi Olatunde, City News.